Good morning. This is Della Schmidt with the Greater Burlington Partnership, and we're going to get started this morning with our community update with Great River Health. I'm pleased to welcome Matt Wenzel, President of Great River Health, with us on the Zoom call this morning. How are you doing, Matt? Oh, Matt is muted.
Can you hear me now?
Thank you, sir.
You're welcome.
Before we begin, I do want to make just a quick little program note for folks on the call. You and I are going to have a brief conversation, but I do want to encourage some questions from those who are listening in. So I want to remind folks that there is a chat feature on the bottom of your screen for those who are joining us by Zoom. And if you would like to put in a question, Jeremy Hess, Director of Economic Development here at the Partnership, we'll be kind of fielding those questions, and Matt, he'll be asking those of you a few minutes later into the conversation. So folks, go ahead and feel free to enter those questions via that chat feature. So Matt, I want to begin with a thank you. You folks at Great River Health are really on the front line of all of this COVID-19 response. And I know you've heard it from other parts of the community, but this is my first opportunity to look at you and say thank you for your leadership and everything that your team there at Great River Health is doing.
Thank you. I appreciate it.
So how are you doing? And how is the entire staff at Great River Health? How's everyone holding up?
I think on the whole, really well. And it gets back to where we started with our plan. And right when we kicked off what we call incident command to fend off the crisis and hit it head on is that we established our mission from the beginning is equal parts taking care and making sure that our patients, employees are safe and providing fact-based information to our community. So how we're doing that is remaining calm, dealing in facts, knowing the plan, and then executing upon the plan. I think that's provided some comfort, a lot of comfort with our employees, knowing that we're prioritizing their protection as much as we are our patients. Without employees in our workforce that feel that way, we're not going to be able to take care of our patients. So I think morale's pretty high right now.
Thank you for that. And again, I know the community is just so grateful for all of the incredible staff there and all that you folks are doing. There is kind of a top of mind question that I know is frequent in the minds of folks in the community. And to the degree that you have insights, can you share with us what you may know about the status of COVID testing in Des Moines County right now, or what the future of testing might look like for our county?
Sure. So I would start with saying that we've tested 100% of the people that qualified for testing per CDC guidelines. So as people hear about shortages and needing more tests, it's absolutely right. But it's not just our community. It's across the nation. And so I really like to remind people is that we've tested 100% of the people that follow CDC guidelines. What recently is rolled out is to advance, to expand testing across Iowa is Test Iowa that Governor Reynolds mentioned last week in a press conference. And would like to take the opportunity to let everyone know that here at Great River is that we really are looking through the lens of is that if there is ever any criticism, we want to be criticized for being proactive and being over-prepared than under. And so we really are trying to look at through that lens. Perspective being that we called, Tom Green's been a huge advocate, Senator Green's been a huge advocate for us. So he reached out to Governor Reynolds and had a conversation with their chief of staff on Thursday, because we've right now got, through a great relationship partnership with SEC, we're ready to go in a day's notice, and we could test hundreds of patients a day, but we just need tests. That's what I told the governor's office is that let's make sure that we're coordinated. And if you can get me the tests, I can put it in the hands of the providers, and we could open up, and people could go and do Test Iowa, go through the algorithm, get the QR code, and then go through our testing center. And that seemed to resonate with her chief of staff, and she said that they're working on that, and then we'll get back to see if that's a possibility. But right now again, this is all finish where I started with that question, is we've tested 100% of the people that needed testing for CDC guidelines. And until we as a nation have rapid cycle point of care testing and more prevalent in the hands of providers, is that we won't be where we need to be.
Well, thank you for sharing that with us, but it does sound like you have taken all the steps necessary to be prepared that when more testing kits are available, that Great River Health is ready to provide that additional testing to our county. So that's very good news.
Yeah, it was I'll say nice to hear, and maybe it's just misery loves company, but we were on a call with IHA, Iowa Hospital Association, and someone mentioned about the Test Iowa. And someone said, well, someone's already reached out to the governor's office to see if they could get that in their community. And it was funny because I was talking to colleagues afterwards, and they were thinking that that hospital had to have been a Des Moines, Quad City, Iowa City hospital. And here we are in Burlington working every angle we can to get them here. So, yeah, I've been on the phone with Senator Grassley in Ernst's office, Representative Loebsack. Anything we could possibly do to get tests here is I assure you, we are trying to do.
So that kind of leads to the other supply question. There was a lot of concern initially and ongoing about the personal protection gear for your staff. And then, of course, last week, the governor made an announcement that seemed to be somewhat encouraging about maybe opening up some procedures, medical care that hasn't been offered. But of course, you have to be able to have all the things that you need to be able to step into that place. What are you looking at as far as operationally from Great River Health?
Yeah, so the proclamation last week falls under the auspices of the devil's in the detail. And so to say that it's opened up, I think on surface level is accurate, but then you start diving into this, and there's 6 criteria that need to be met. And so we've got a team right now that's working on this. We're trying to figure out how we're going to operationalize it. One of the biggest criteria there is as you mentioned, the PPE. And so we have to ensure that we go back to where we started is our priority is to protect our patients and employees and provide fact-based information to our community. So we're not going to do anything that jeopardizes that mission. And I mention that because is that we got to make sure that we have the appropriate PPE. And we tried figuring out what does it mean to have appropriate level of PPE from this proclamation. And I think the best guess that we can get is that you would not be able to get into the state stockpile if you are to resume elective procedures. So that's just to show you is that hospitals across the state are trying to figure this out because on surface level it seems really good, but yet it puts us into a precarious situation where we're trying to, just like most other businesses is figure out, is this the right thing to do at this time? And so we've got a team working on that right now.
So can you expand on where things are at with telehealth and on-site services that are ongoing?
Sure. So I'll give you a little context with where we're at, and I'll just talk about revenue. And so right now is that pre-COVID to now is we're down 44% off our revenue. So for Great River Health, that equates to $11 million a month. So every time every month goes by is $11 million off revenue. And that doesn't even include the additional expense. Our biggest hit areas, as you would imagine, are outpatient services because pretty much everything got shut down. So that kind of gives you some perspective on what we're facing financially and what we've had to shut down or furlough during this time. Telehealth. So during times of crisis, when you have the mother of great invention and necessity, and so telehealth's been out there, but that's one of the things that we've really been able to ramp up and accelerate. And I see there post-COVID that we will continue on with telehealth. It's just a matter of how that will look, because what's happened is CMS has put out several different waivers that has laxed a lot of the rules for us to be able to provide, and not just, when I say we, I'm talking the global, or I should say national we here, is a lot of the rules that we're able to provide telehealth in a different way. So those waivers, I'm sure, will go away afterwards, and then we're going to have to see what's the best way to make this stick for our community.
Okay, well, I'm going to be punting this over to Jeremy here in a few minutes, but you know, one of the big things that employers are wondering is regarding steps of what they can be doing to help their employees stay safe and be healthy. Maybe you have some advice or some counsel on that that you'd like to share?
Yeah, regrettably is that, and I don't think anyone would expect a silver bullet because there isn't one. And so right now, if you look at across the world, is that the arrows that we have in our quiver available to us are limited. Really, it's what we all have been hearing: social distancing, practice hand hygiene. And I sure hope this is one thing that sticks afterwards. I mean, how many people have walked out of a public restroom and people are not washing their hands? It's disgusting. So we as a society, I hope this is one thing we can all get better at, is wash your dang hands after this is over. We don't need COVID to wash our hands.
That's right.
Cover coughs and sneezes. And so until we get a vaccination, until we get access to better testing where we can have point of care, swab somebody, put it in, and you get the test immediately. Or we have better treatment plans where it minimizes the effect of this virus, is that we're really limited on what we can do. So as a business, and I would just say in general, is we have to continue to practice the social distancing until we either build a herd mentality around immunity, or we get one of the other three options. Hopefully they'll come soon.
Well, of course, there's a great interest in opening up our local economy at some point in the future, hopefully not in the too distant future. And is there any thought that you have or steps that Great River Health might be taking in preparing to advise businesses that up to this point have not been able to be open operationally or open to the public, even up at the partnership offices, our offices closed to the public? What things should we be thinking about now in preparation for opening up, even on a limited level, and what steps business owners can be taking to kind of prepare for that? What are some things that you would encourage people to be thinking about? Yeah,
so it's not going to be a flip of the switch. I don't think anybody expects that. There's going to be a process running with where it was during COVID and during you shut down to the time of full back to what we'll say is life is normal. So what's it mean and look like during that time And so what I would advise people is and business owners, and especially those that, which are many, is interact with the public, is I would look and see what colleagues are doing across other states where businesses are opening. And I think you can get some good advice there. So what we're doing here at the hospital is just that. When we're looking through these proclamations and we're having to run parallel processes where we're going to still have our COVID unit. So we've took a unit where we were using for digestive health and converted that into a 28-bed COVID unit. Well, just when the governor, let's say that whatever date everything is quote unquote open back up, we're not going to just shut that down. We're going to have to keep that open and run that in parallel with normal operations, whatever that means and looks like, until we're back to full speed. I encourage other business owners to be thinking that same way, is until you get back to life is normal. I keep quoting that because whatever that means is I'd really encourage you to think about what's the transition and interim plan from when the governor says you can open back up to what I'll say is life after COVID.
Okay. Well, thank you for that. Jeremy Hess, are you ready to maybe share some of the questions that have been coming in via the chat?
Yeah, I'm trying to wade through some of those, and of course, Matt, we would be able to, if there's a question that may not be appropriate for the whole community here that we might be able to shoot to you privately, we'll do that afterwards, if you're okay with that. And then, so one of the questions early on here that I saw come across was, you know, we've seen efforts in our community and other communities where folks are wanting to help with the supply of PPE. And so we've seen some efforts where folks have been making masks and cloth masks and those kinds of things. You've already touched on it a little bit. What's helpful? What's not helpful? What would you say about folks who want to be helpful towards supplying our workers with appropriate PPE?
Yeah, well, let me start with the great community support that we've got and have received, and I suspect that, and hope that we will continue to do so, is we've got masks donated to us, and would want to start with appreciation for that. We've had also local businesses that have PPE, N95 masks, surgical masks, or some variant of that. Just hand them over to us. So that's been extremely helpful. Continuing with cloth masks and with the PPE is I would say working with Melissa Jones and her department, so we can help identify needs, get those out. But at this point I think the biggest thing is cloth masks. And if there's anybody that has any in with N95 masks or surgical masks, then please get a hold of Melissa. And as crazy as that sounds, that request went out through a physician that had a patient, and that turned out to be a great resource for face shields. So this company pivoted. They're out of Mount Pleasant, so sourced locally. And we ordered 10,000 face shields from this company. So again, as crazy as it may sound, is to ask for PPE from those that are listening. It's worked in the last 6 weeks.
Great. You spoke a little bit about the whole Test Iowa thing versus the testing that you're doing at your hospital or other hospitals are doing. Can you talk about the difference there between the Test Iowa and the testing that you're doing or other hospitals are doing?
Yeah, great question. And in fact, there is no difference. What's happening is that a fun little fact, if you will, is when they being the test sites, which right now there's one in Des Moines that opened up over the weekend. There's another one, I believe, to be scheduled that I read in Waterloo in the next week or so. And when they do the swab, so after you go through the algorithm, get your QR code, schedule an appointment, you go to this center and they do the swab, they send it off to the same place that we send ours to, the state hygienic lab. And then the state hygienic lab turns the tests around and then gets them back to the patient. Now, I'll tell you what we're starting to see just over this weekend, and I don't know if it's cause and effect, but it seems pretty coincidental that we were getting 24-hour turnaround time with the state hygienic lab. And you wouldn't want that if you're the patient inside the hospital trying to figure out, do you have COVID or not? Because they're sicker than just the person, as you would imagine, self-quarantining at home. That's why they're here. What we're starting to face, and this is news I just got this morning, is that State Hygienic Lab is scheduled and up to do a capacity of about 500 tests a day just recently, and we don't know why, but again, it seems pretty coincidental is that they're getting over 5,000 now, is what we're starting to see. So what's happening with that is that we are having to hold on to PUI, a person under investigation, meaning that we don't know if they have it or not, because we're waiting a longer time now to get those test results back through the state hygienic lab. So they're doing their best, but it's starting to create what seemingly seems is more of a slowdown. The other thing with testing I would tell you is that we've got all the equipment. We're ready to go. And this is not just a Burlington thing. This is across the country, is that these point of care tests that I talk about, we could run them. I mean, heck, if we got the, what's called medium, if we got the tests in, we could start running them today or tomorrow. So it's not for either a lack of effort or a lack of not trying, is that everywhere across the country is trying to get either Abbott or these CFID tests, and we just can't get our hands on them for obvious reasons.
Along those lines, what I might get out of my league here medically here real quick, but what are your thoughts on the effectiveness of antibody testing, and what's that next round, or how's that work, or as far as trying to be a tool to get folks back to work as we move forward?
So I think it serves two purposes. You've got the one that's the antigen that's showing whether you have the virus or not. So essentially what it does is it takes part of this RNA strand in DNA, multiplies it, and then sees whether you have that strand of virus or not. So that's the antigen test that you're hearing about what we're doing. And I think that on the back end, and what I mean by back end is that if you're wanting to go back to work, if you're wanting to see if you have immunity to it, then that's when you want the antibody test. And so the antigen test is showing whether you got the virus or not. And then once you recover, then you build up immunities. And I think that you can read all the different media outlets, and they're going to tell you different things, because I think as a society, we're still trying to figure out, is this thing mutating? How quickly? What's it mean? So just because you have antibodies built up today is not certain that that's going to protect you a month, 6 months, a year. This is what epidemiologists are trying to figure out right now.
Along those lines, so even right now, while we're still in the throes of this thing, there's been some mixed reports out there on masks and glove use in the workplace. So not at the hospital specifically, but at other local businesses. Can you speak to the effectiveness of that, or thoughts on recommending that, or? Yeah,
so the cloth masks and paper masks, anything that's not, I would say, N95 or medical grade, I think we could all agree, wearing a curtain around our face is not medical grade. And I say that somewhat jokingly because I get a lot of questions when I'm rounding, how are you doing? And it's like, great. And then I have to put it in perspective. Who thought 3 or 6 months ago, we'd be wearing fabric around our face. So to that end is that with the cloth masks, they're more meant to protect others around you. It really goes to covering coughs and sneezes. That's just a medium to do that. So I wouldn't want false pretenses for people thinking they're protected by wearing something that's not appropriate or medical grade, like an N95 masks. The other thing I would say is with gloves is that where it's transmitted is either airborne droplet or and again, researchers are still trying to figure out what exactly and how it's transmitted, but and you hear differing longevity on how the timing of that. So I think gloves are a good practice. The last thing you want, though, I mean, this is obvious, is if you're wearing a pair of gloves and then touching your face, it's really not doing a lot of good. I encourage people to wear gloves, I think, and cloth masks, but understand what that means and why you're wearing them.
So, I know everybody's very appreciative of the great facility and staff that we have here locally. We have a great hospital. We have great people. How can folks in the community best support your efforts out there ongoing? How do obviously washing hands and staying safe and so forth, but what's just any ideas on how we can just better support our physicians and nurses and all the staff at Great River?
Well, thank you for the question. And let me start with the plan and talk about that it really is community-based. It's communal. It's not just responsive to just the hospital. And I think that fits in nicely with how people can help. So one is it's all the things we just went through: coughs and sneezes, social distancing, wash your hands. And then the second part of the plan for us is we've set up a hotline, a nurse line that people call in and ask questions related to COVID. The next one is that each of our campuses, Fort Madison, Burlington, Henry County Health Center, is that we've got a respiratory center if people need to come in and get tested. And then within hours notice, we could set up the drive-through center if that's needed. I mentioned that a little bit ago, which is not set up because we haven't seen the need yet, nor do we have the tests to do. And then lastly is that we mentioned the COVID unit that we've set up. So we've done a lot of planning, and I think what the community can do is the start of that is help protect yourself and those around you. The other thing I would say is it gets back to how, as a hospital, and I think this is the community as well, that we're fending off this pandemic is one is all of us collectively have to stay calm. And what I've mentioned about how I've described this is that if there's a little turbulence on the plane, you see the pilot running down the aisle, everybody's going to freak out. So we in healthcare have to make sure that we remain calm. To do that is we got to know facts, and especially during this time with us as a community is that I would encourage everyone to know facts, because it's not just distracting. It can be dangerous when we shift as a community our way of thinking or our calling and trying to not deal in facts. So how you deal in facts, and what we've been doing is CDC, Iowa Department of Public Health, and then for the community is we've put our plan. We've been very transparent. And so go to our website, and I think Melissa, I wouldn't say this just because she's sitting across from me, is that has done a great job. And on our website, we've got the 3 links at a macro, national, local, state, and then local. So let's deal in facts. And then lastly is that as a community, let's all execute upon the plan. So if you think or you're suspecting that you have COVID symptoms, call the hotline, please. If you can, don't just show up to the ER because we want to route you to the respiratory center. So that's not a statement to say you can't go to the ER, you shouldn't go to the ER. It's simply to say that we would prefer you to start the process with the call center, and then they can get you and route it into the appropriate setting, so we don't put healthcare workers at a higher risk of coming in contact with folks that have COVID. From a community perspective, outside of just that plan, is continued support, thoughts, and prayers is always appreciated. And if there's any ideas that you have, anybody on the call or any groups that you're associated with that would like to show support to our healthcare workers, please get a hold of Melissa Jones, and she can help coordinate that. But we've had people going out and doing sidewalk chalk and just saying, you know, healthcare heroes, enter here. I've just heard a lot of great comments from our physicians and healthcare workers about how they feel appreciated during this time. And I hope as a community, both nationally and locally, is that we don't forget that after COVID, is that this came to life for me, guys, when I came into the ER and was rounding, and there was 2 nurses fully garbed up, looked like they had spacesuits on, and they were walking out of the ER room, negative pressure room, taking care of a patient with COVID. They were positive. And I asked them, I said, how you guys doing? And 2 ER nurses, and they couldn't have been more delightful. And just a servant's mentality. These are the people running into the fire. And they said, we're here to serve. We're here to take care of this community, and we're proud of what we do. Now, Matt, you may want to step back because we're getting ready to go back in. And it was just amazing to see that. So let's not lose sight of that. These are the people that are protecting us as humans each and every day. And hopefully we don't have to have COVID lose this thought on us. Is I hope this sticks. So any way people can show support to healthcare workers would be absolutely appreciated.
All right. Well, thanks. I'm going to turn it back to Della here for appreciate your time and answering those questions, man.
You're welcome.
Thank you, Jeremy. And again, Matt, on behalf of the Greater Burlington Partnership and the community as a whole, I so appreciate you spending some time with us this morning. I know this is an incredibly busy and demanding time on you, but it's so good to be able to hear directly from you. Indeed, we do have you very much and your team on our hearts and minds, and that will continue in the weeks and months ahead. Thank you for your support, and we look forward to maybe doing this again at some point in time as we get some sort of direction about what opening up Des Moines County might look like. It'd be great to have your perspective as that rolls forward. So again, thanks to everybody on the call. And I know there's a few questions that came across the chat that we didn't get a chance to get into today, but we will engage with Matt and the team at Great River Health and see if we can get some folks to answers to that. So thank you, sir. If you have any closing comment, that would be fantastic.
I think that, you know, I'd go back to is the question Jeremy raised I can't tell you how much I appreciate our employees that are taking care of all of us. I can't tell you how much I appreciate the community that's rallying around this cause. Again, I just hope we don't lose this momentum and goodwill that's being created. And I hope people feel, because all the decisions that we make are going back to this mission of protecting our patients and employees and providing fact-based information to community. If we're going to get blamed for anything, I want to get blamed for being prepared and overreacting, and not that we missed it. So thanks everyone for your thoughts and prayers to our healthcare workers.
Thank you, Matt. Have a good day.
You too.